We're here to help you as a healthcare professional really master the language you use every single day with patients and colleagues. The goal? To help you communicate with total clarity and confidence.
Today, we're going to master 3 incredibly common and super useful expressions that will help you sound more natural and professional. We're talking about chase up, red flag, and touch base. By the end of this, you'll know exactly how and when to use them.
And hey, if you're ready to take your skills even further, the Medical English Collection is the perfect next step. It is just packed with resources like practical patient dialogues and OET prep courses, all designed to build your confidence. Visit australiabiomed.com/med to explore the full Medical English Collection. First up is the phrasal verb chase up. You will hear this one constantly in clinics and hospitals. It's all about getting updates on things that are still pending.
So, what does it actually mean? Well, to chase up something is simply to check on its status. Think about test results, referrals, or prescriptions that you're waiting on. And this is used by everyone. Both patients and healthcare staff use it to proactively find out what's going on. Now, a quick tip, if you're more used to American English, you'd probably say follow up on, which means the exact same thing.
Okay, let's talk about how to say it. The stress falls on the first word, chase up. Listen one more time. Chase up. When you say it like that, it just flows, like a single, confident action.
You know, context is everything. You would absolutely chase up non-urgent blood test results or a referral to a specialist. But you would never, ever use this for an emergency. Saying something like, I need to chase up my chest pain is just way too casual for such a serious situation. So the key takeaway is this. Keep it for routine, non-urgent follow-ups.
Let's look at 2 mistakes that happen all the time. First, you can't forget the word up. If you say, I will chase my results, it honestly sounds like you're going to run after a piece of paper. You have to say, I will chase up my results. Second, if you're using a pronoun like it or them, it has to go right in the middle. I chased it up, not I chased up it. Okay, time for you to practice. I'll say the sentence, then I'll pause so you can repeat it out loud. Ready? Here's the first one. Could you chase up my x-ray results? They should have come back by now. Great. And the second one. I'm calling to chase up an appointment I was supposed to receive a letter about. So to quickly recap chase up, it means to check on something that's pending, and you use it for routine follow-ups. Simple as that. Let's move on to the next one. Our next expression is red flag. Now, this one is incredibly important for patient safety, and you'll hear it used all the time by both clinicians and, of course, concerned patients. A red flag is exactly what it sounds like. It's a warning. In medicine, it's a symptom or a sign that points to a potentially serious underlying condition that needs immediate investigation. I mean, think of things like chest pain, sudden vision loss, or unexplained weight loss. These are all classic red flags. Pronunciation for this one is pretty straightforward. You give equal stress to both words, which gives it that sense of urgency and importance. Say it with me, red flag. See? Each word is clear and strong. So when is a symptom a red flag? Well, a sudden, severe headache could be a red flag for a stroke. That's a perfect time to use the term. But what about a mild headache with no other symptoms? Well, that's just a headache, not a red flag. Using this term correctly is so important because it helps prioritize care and also helps manage patient anxiety. All right, let's look at a couple of common errors. It sounds a little odd to say, I have red flags. A much better way to say it is, I have symptoms that might be red flags. You see, the symptom is the red flag. It's not something you possess. Also, instead of asking, is this a red flag symptom, it's much more natural to ask, is this symptom a red flag? All right, let's practice this really crucial phrase. I'll say it, then you repeat it. First up, the doctor told me that sudden vision loss is a major red flag. Okay, now the second one, which is a fantastic question for any patient to ask. I want to know what red flags to watch for while I'm on this medication. Quick recap for red flag. It means a serious warning sign. You stress both red and flag, and you use it to identify symptoms that really need immediate attention. Got it? Excellent. And our final expression for today is touch base. This one is so common in professional settings, and it's perfect for managing ongoing patient care without having to schedule a full appointment for every little thing. To touch base simply means to have a short, informal conversation just to get an update. It's not a full consultation, it's more like a quick check-in. A patient might use it to talk about how a new medication is working, or a doctor might use it to plan a quick follow-up call.
The pronunciation here is just like red flag. You give equal weight to both words. Touch base. It's what we call a fixed expression, so it always flows together really naturally. Touch base.
So, what's the right situation for this? Well, it's perfect for checking in with a patient you already have a relationship with, maybe to follow up on a new treatment. But you wouldn't use it for emergencies or to book an initial consultation with a brand new doctor. The key thing to remember is that it implies an existing, ongoing care relationship.
Let's clear up the most common mistakes with this one. It is always touch base, singular. Never touch bases. That's a super frequent error. Also, there's no article the. It's not touch the base, it's just touch base. Think of it as a single unit, a fixed phrase.
Okay, your turn to practice. Let's start. My doctor said to touch base if the symptoms don't improve. Nice. And the second one? Can we touch base before my next appointment to discuss the test results?
And the quick recap for touch base. It means a brief, informal check-in. You stress both touch and base, and it's absolutely perfect for quick, non-urgent updates.
So there you have it, 3 essential expressions to make your medical English sound so much more natural and confident. Just remember, chase up for updates, red flag for warnings, and touch base for those quick check-ins. Mastering these is a huge step forward. And if you're ready to keep building your skills, visit australiabiomed.com/med to explore the full medical English collection. It's got courses on clinical dialogues, patient-centered language, OET prep, and a whole lot more. Thanks so much for joining this explainer.